Evening primrose oil, found in Eve Prim-Linoleic-Gamolenic Ac Capsules, is used to help with breast pain, including pain related to the menstrual cycle. It is important to note that there is no evidence to support the use of evening primrose oil for preventing or treating cancer. If you have concerns about cancer, it is best to consult with your doctor. Additionally, it is important to be cautious when using herbal or dietary supplements, as some products may contain harmful impurities or additives. It is recommended to check with your pharmacist for more information about the specific brand you are using. Lastly, it is important to note that the FDA has not reviewed this product for safety or effectiveness, so it is crucial to consult with your doctor or pharmacist for more details before use. As for dosage and timing, it is best to follow the recommended guidelines provided by your healthcare professional. Taking Eve Prim-Linoleic-Gamolenic Ac Capsules is simple. Just follow the directions on the product package and take it by mouth as directed. If you have any concerns or questions, don't hesitate to ask your doctor or pharmacist for guidance. If your condition persists or worsens, or if you suspect a serious medical issue, seek immediate medical attention. Some common side effects of Eve Prim-Linoleic-Gamolenic Ac Capsule may include upset stomach, nausea, soft stools, or headache. If any of these effects persist or worsen, it is important to seek medical advice. While rare, a serious allergic reaction to this product may occur. Seek immediate medical help if you experience symptoms such as rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you experience any other effects not mentioned here, it is advisable to contact your doctor or pharmacist. In terms of dosage, the recommended daily intake of Eve Prim-Linoleic-Gamolenic Ac Capsule is typically determined by your healthcare provider. It is best to follow their instructions for the most effective and safe use of the medication. As for the optimal timing of taking this capsule, it is typically recommended to take it with food to help minimize any potential stomach upset. However, it is best to consult with your healthcare provider for specific guidance based on your individual needs. Before starting to take Eve Prim-Linoleic-Gamolenic Ac Capsule, it's important to talk to your doctor or pharmacist if you have any allergies or if you have any bleeding or clotting problems. Additionally, if you have diabetes, alcohol dependence, or liver disease, it's important to use caution with liquid products that may contain sugar and/or alcohol. If you are planning to have surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's also essential to note that this product is not recommended for use during pregnancy, so be sure to consult your doctor before using it. However, if you are breastfeeding, this product is unlikely to harm your nursing infant, but it's still important to consult your doctor before using it. As for the daily dosage and timing, be sure to follow the instructions provided by your doctor or pharmacist for the best results. It's important to be aware of potential drug interactions, as they can affect how your medications work and increase your risk of experiencing serious side effects. Be sure to keep a list of all the products you use, including both prescription and non-prescription drugs, as well as herbal products, and share this information with your doctor and pharmacist. It's crucial to consult with your doctor before starting, stopping, or changing the dosage of any medicines. Some products that may interact with Eve Prim-Linoleic-Gamolenic Ac Capsule include medications and herbal products that may increase the risk of bleeding, such as blood thinners, antiplatelet drugs, and nonsteroidal anti-inflammatory drugs. Aspirin may also increase the risk of bleeding when used with this product, so if you have been directed to take low-dose aspirin for heart attack or stroke prevention, continue taking it unless instructed otherwise by your doctor. Additionally, this product may interfere with certain lab tests, potentially causing false results. It's important to inform lab personnel and all your doctors that you are using this product. As for the daily dosage and optimal timing for taking Eve Prim-Linoleic-Gamolenic Ac Capsule, consult your doctor for personalized recommendations. If someone has taken too much of this capsule and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Make sure to keep up with your regular medical checkups and laboratory appointments. This will help your healthcare provider monitor your progress and make any necessary adjustments to your treatment plan. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Take your next dose at the regular time. Do not take 2 doses at once to make up for the missed one. Make sure to check the storage information on the package before using Eve Prim-Linoleic-Gamolenic Ac Capsule. If you have any questions about storage, ask your pharmacist. And remember to keep all medications and herbal products out of reach of children and pets. When it's expired or you no longer need it, make sure to properly discard this product. Don't flush it down the toilet or pour it into a drain unless instructed to do so. For proper disposal, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.